I get engaged in conversation with patients in the clinic every day, what plans they're making for 2026. And that, of course, focuses on what plans potentially surgically. So I am thrilled to have Dr. Gabrielle Miotto, who is a plastic surgeon that I have had a privilege to refer a lot of patients to, and they're all coming back so happy and excited and looking beautiful. So I thought that we would focus today's conversation a little bit about when is the time to start thinking potentially about surgical intervention, surgical interaction. We prep patients, we utilize many non-invasive procedures, and for many patients, those were great. But at different age groups, ask me the same questions. When could there be a time to go and see Dr. Miotto?
When it's time. I have this question every day, and I think it's a very important question. I have basically two populations of patients that are thinking about this. The patients that are in their early 40s, mid 40s, that are seeing a lot of changes, going through perimenopause, menopause, or even maybe a little earlier. The changes come first in the eye area. Usually patients are seeing that skin building up, the brows are dropping, maybe a little loss of volume, maybe under eye bags. And I do, we do that type of surgery at this age very often. But then I also have the patients that are starting to get bothered by the lower face and neck, sometimes early 40s, mid 40s, but then mostly mid 50s, 60s, right? They have taken care of themselves. They do all the non-surgicals, they have done it, but they're not seeing the changes they used to get with that. And jowls, neck, with the muscle laxity, really non-surgicals are not powerful to make the changes that the patients are looking for. So that is then when we discuss about the facelift and the neck lift. And if the patients have not had eyelid surgery by then and they feel like, okay, it's time to do everything together, that's also an opportunity where we combine everything. So usually we can do certain things separate. Usually we do like upper face, then we do lower face, but it's very common also to go together. And it's when patients are seeing like, I don't get the same results with neurotoxin anymore, my brow doesn't lift as much, I don't want to be doing this many fillers because it's not about filling anymore, it's about lifting. And that's what it is.
So the needs change. I think the other reason that there's so much excitement about this, and we see all these celebrities then disappear for 3 days, and then they are looking glorious and fabulous. That's a little bit extreme, but in a nutshell, it appears that the recovery has become a little bit easier. So I think maybe that's why the heightened interest, the techniques have improved, changed. Comment on that a little bit.
Yes, that is really a reality, because the old school, old look and a lot of recovery has been changed, I would say even the last decade. But we have optimized not just the surgical techniques themselves, but the way we prepare the patient and the way we treat the patient after surgery. So in my office, for example, I start taking care of the patient and preparing the patient a week before surgery with supplements for bruising, healing, speeding recovery, for medications that will minimize their pain after surgery, that will minimize narcotic use. In surgery, the things I do to minimize bruising involves anesthesia, my preparation, my technique, and after surgery we'll also add hyperbaric oxygen chamber, red light therapy, lymphatic drainage, all sorts of some products for healing and for scar treatment that really shorten the recovery, make it much more comfortable than what it used to be. And depending on the surgery, I have a lot of patients going back to work in a week or two. Depends also a lot of the patient bruises a lot, skin quality, other things. If we add the resurfacing, which gives that extra swelling and other, but it has become so much better, and I'm really happy to do that, because as a working woman and as someone that does things, we want to short, and it's just the way we are.
I think patients understand that. This is where I kind of I'm going to say, okay, come still see your dermatologist, because I think the week prior to surgical procedure is important. I have borrowed your statement that you've made some year ago or so, that it's so much better to work with silk than burlap. I have said this many times to patients. So really prepping with us for months, and understanding what the goal is. And typically the consult is done months in advance.
Right.
So there is room to really get ready and plan for a procedure.
Yeah.
Is there such a thing as a facelift that's a little bit too early?
I don't see a facelift as a rejuvenation, because when the facelift is really good is when there is basically a little bit of muscle laxity, right? So when the bands don't go away with Botox anymore, when we need to be emphasizing a lot of energy devices to try to lift that skin. Or some patients, genetically, or even because they lost a lot of weight with
Right.
GLP-1s, with bariatric surgery, yes, they have early aging and early laxity. But I think I would say in the 40s and on, the age sometimes is just a number,
Of course, yes.
and it really is the goal, is the anatomy, is the patient's expectations of where they want to go. But my goal is to make patients look like themselves and better. It's usually 5 to 10, sometimes even like 15 years younger, but you never look like, oh my God, what have you done?
Well, I think that's the
Right.
scariest part. That
Yeah,
everybody
exactly
goes, well,
right.
I kind of like the way I look. I just don't want to really change the appearance. I
And
want
that's
to
the
be
patient
referenced.
I would like to work with, because
Right.
that's exactly what I would like to produce.
Yes.
Yeah,
yes,
I want you looking like you,
Right.
but better.
Right.
That's
and
it.
I think that's a big concern, and then probably with the older techniques, and without getting too surgical, how have those techniques improved and changed?
The handling of the tissues are much more delicate, at least the way I see it and the way I do it. We minimize anesthesia time. We use certain things in surgery to minimize bleeding. The way we cauterize the tissues and the tools we use are also advanced. I even use like an ultrasonic cautery when I need to do deep neck work and things like that to minimize bleeding and other things.
Yes.
So we need to just also optimize the patient like you do, preparing the skin, health in general. Like, what is your intake? What are you eating? How are you sleeping? Certain things.
I think that's such a depth of understanding. I love how the approach post-care has changed. I had a privilege to go to a Korean meeting, and hyperbaric oxygen is everywhere. It does seem to make a big difference, doesn't
Yeah,
it?
it's part of the care. The patients feel the difference. I go there. I go in the chamber myself after a long day of surgery just to recover.
Oh, now I'm going to start popping.
Exactly.
Like, why is Santa Maria again here? Wonderful. Well, you have a beautiful new space. Are you spending some time in the clinic and half a week in surgery? How does your schedule?
So I operate Mondays and Wednesdays. I try to see patients Tuesdays and Thursdays. And I see the work I do as very, detail oriented. And I don't try to squeeze a lot of patients on my schedule, because I want to give my absolute best for that patient there. So if it's a facelift, a full surgery is one patient a day. I do not operate on more than one. I just try to give the care I would like to receive. So,
well, definitely always quality over quantity.
Absolutely.
That's for sure. That gives all of us so many wonderful options where to treat non-invasively, when to consider a surgical approach. And I thank you very much for joining me.
thank you.
Thank you.